common case type that I see in my office and that I treat. I see it a lot with older patients, but in this case, this is actually a college student. You can notice the tremendous enamel chipping and wear on the upper and anterior teeth, and there are a lot of contributing factors to this, but certainly one of the main ones is that the bite is edge to edge. And so when the teeth are biting on the edge, there is going to be more of a tendency to have this chipping, because at all times these teeth are in contact. Every time the patient is eating, moving their jaw, sometimes even speaking, there's going to be some collisions of those teeth. The patient has an underlying class 3 tendency. You can notice it a little bit with how this premolar is a little bit distal than it should be compared to this. You can see it same over here. But there's also a Bolton discrepancy, meaning that the upper teeth are simply small collectively, and so therefore the arc sits not as far forward. And so the only way to correct something like this is really to get to the heart of the issue. That is that these teeth are small, and of course they're in an edge to edge. And so the plan from the beginning was to advance those teeth, and by moving them forward, they will move away from the lower. At the same time, we can also bring the lower teeth in, but I'm going to focus on the upper here. But of course, when you do this, you're going to open up spaces between the teeth. And this, the patient, of course, needs to be aware of. And because the teeth are small, it's a natural fit that the patient would have restorations on these teeth, because they need them anyway, because look at how worn the teeth are. So this patient was very receptive to this plan. Not all are, but this patient was, and here's the final result.